Hey guys, this is Mike with PhysioU, and I'm here with our guest, Dr. Wang from Dalian, China. He's a visiting scholar at the Keck Medical Center at USC and a part of the PhysioU translation team. So it's awesome to have you here. Thanks for joining us.
Yeah, hello guys.
So today, for our mentoring minute, we are talking about DeQuervain's Tenosynovitis. So a tendon problem related to the abductor pollicis longus or the extensor pollicis brevis. Now, the research generally suggests that women are 3 to 10 times more likely to get this problem. So why is that? One of the potential hypotheses is that they're more flexible, which means they go into end ranges, which may put friction on the tendons. And perhaps that they are involved in more repetitive hand-type activities. So some of the common names for this is the washerwoman's thumb, or the new mother syndrome, or the mother's thumb. And it was very interesting. Dr. Wang said, it's actually not the moms who tend to have this problem. Why don't you share a little bit about in China, who are the types of people who have this DeQuervain's problem?
Yeah, in China, in my clinic, this disease often in common in grandmothers. Yeah.
Oh, so it could be called the grandmother's thumb.
Yes.
Why do you think that's the case?
Yes, because in China, grandmother in charge of babies ADL.
And all the activities of daily living.
Yes.
So, in fact, because in China, most of the moms go back to work quite soon,
Yes.
it's the grandmas who are lifting the babies, constantly doing thumb abduction, possibly with the wrist in ulnar deviation, coming to scoop up the child. So you can imagine, as the hand is in ulnar deviation, doesn't that put more strain on this tissue? And yet, the thumb needs to abduct or extend so you can get underneath the baby. So really, this is a movement problem. And it's a movement problem particularly when the wrists are not in neutral. There's another interesting case study. A case study about a physician who does colonoscopies. Why is he having this thumb pain? Is this a colonoscopy thumb? Because he's gripping and moving and doing this over and over. It's an overuse syndrome problem. Serves him right for doing colonoscopies, but we need it, right? We need it to screen out for cancers, but you can see that this is not just a mother or grandmother. This is a repetitive use problem, particularly when the wrists are not in neutral. So the main thing that I want to share is that DeQuervain's tenosynovitis, even though we think of it as just a muscle power, a tendon problem, that remember that it is the way that we move and the overuse of these tendons in positions that put the tendon in friction that end up resulting in this prolonged and very disabling pathology. So when we manage this type of problem, remember we consider this as a muscle power deficit. Oftentimes you'll find that there's range of motion loss, okay, because there's certain parts of the range will stretch the irritable tendon, parts of the range will use the irritable tendon, and so there's often range of motion loss, there's power loss, and therefore it's very important to teach patients to first rest. Just like any muscle tendonitis, tendinosis that's highly irritable, we always generally begin with rest, especially with a thumb in a thumb spica splint, to basically give the tissue some time to rest and not continue to be used. And just like any other muscle power problem, it's probably wise at some point when the patient is less irritable to begin to add a little bit of resistance, whether that is gentle isometrics or eventually gentle eccentrics, something to begin to remodel the tendon. Because it's the same principle. A tendinosis at some point needs to be loaded, and then we need to change the way that patients move. Teach them to try to split the use of their hands, not overuse one hand predominantly over and over again. So share the load, give them strategies on how to do their movements for work without the wrist always being in end range positions and doing a lot of gripping. These are all important concepts when managing DeQuervain's tenosynovitis. So in summary, remember that women are high at risk. This is not just mother's thumb, it is anybody's thumb who overuses their hands for a lot of different tasks, whether that's lifting a baby, doing work around in the house, work at their workstation, overuse of the hand, and the management should always include, especially for the highly irritable, some level of mobilization temporarily to allow those tissues to heal, and slowly to reload the tendon, because with muscle power deficits, with tendinosis type problems, in order to prevent recurrence, we have to remodel the tissue. All right, so I hope that's useful to you. Thank you, Dr. Wang, for your insight.
Yeah, thank you.
And check out our PhysioU apps for more insight on how to manage DeQuervain's tenosynovitis at www.physiou.com. Have a good one, guys.